The next topic is cardiac murmur. What is cardiac murmur? It is the abnormal or unusual heart sound. So that is also known as abnormal heart sound or cardiac brute. The cardiac murmur it is heard by the stethoscope along with the normal heart sounds. Now, what are the causes of the murmur? The cardiac murmur it is produced mainly because of change in the pattern of the blood flow. Normally, the blood flows in the streamline through the heart and the blood vessels. However, in the abnormal conditions, what you will see there will be like in case of valvular disease, what you will see is the blood flow will become turbulent. So that is why it will produce the cardiac murmur. The valvular diseases they are of two types. One is the stenosis and second is the incompetence. Stenosis means narrowing of the heart valve. So when there is narrowing of the heart valves, the blood flows rapidly with the turbulence through the narrow orifice of the valve. That results in murmur. Incompetence refers to weakening of the heart valve. When the valve will become weak, it cannot close properly. So if it cannot close properly, that means it will cause backflow of the blood. That will result in the turbulence, and the disease is known as regurgitation or the valvular insufficiency. So how do we classify murmur? We can classify the cardiac murmur into three types: systolic murmur, diastolic murmur, or the continuous murmur. What is systolic murmur? Systolic murmur is the murmur that is produced during the systole. What are the conditions in which systolic murmur is seen? Number one, when the AV valves become weak. So when these valves become weak, they cannot close properly. So that will cause regurgitation of blood from the ventricles to the atria during the ventricle systole. So it is a harsh blowing sound that is seen with a high frequency. Second can be due to the stenosis of the semilunar valve. So during the stenosis of aortic valve, the left ventricular pressure raises during the systole. So that will cause a greater turbulence in the blood flow. The vibration that can be felt as thrill by palpitation over the neck region. Third, murmur can occur due to the severe anemia because of reduced viscosity and accelerated flow of the blood. Coaction of aorta, it is a congenital disorder that is characterized by narrowing of part of the systemic aorta. So a loud murmur is produced during systole. Diastolic murmur, it is the murmur that is produced during the diastole. It can occur due to the stenosis of the AV valve. So when the AV valve becomes narrow, the turbulence of blood flow occurs during the diastole. So when the blood enters from the ventricles, from the atria, murmur due to the stenosis of mitral valve is heard better at the mitral area. Or it can occur due to the incompetence of the semilunar valve. Because of incompetent semilunar valve during the diastole. Continuous murmur, it is the murmur that is heard in conditions such as patent ductus arteriosus.